Before we begin, I need you to do something right now. Take off your shoes and look at your feet. Not tomorrow. Not later today. Right now. Because one of the signs I'm about to show you could be appearing on your feet at this very moment, and it may reveal a hidden health problem that millions of people don't know they have until permanent damage has already begun. But first, if you're over 60 and you want to protect your memory, your heart, your eyesight, your mobility, and most importantly your independence, subscribe to the channel and turn on notifications. Every week, I share practical, science-backed health advice specifically designed for older adults. Now here's the truth most people never hear. Diabetes rarely announces itself loudly. It doesn't usually begin with dramatic symptoms that send you rushing to the doctor. Instead, it works silently, slowly, patiently, sometimes for 5, 7, even 10 years before a diagnosis is ever made. During that time, elevated blood sugar can quietly damage your nerves, blood vessels, kidneys, eyes, and heart. And almost every single time, your feet begin showing warning signs long before the rest of your body. I'm Dr. David, and after decades of helping adults over 60 stay healthier and more independent, I've noticed the same pattern over and over again. Patients who felt completely fine. Patients who had annual checkups. Patients who believed they were simply experiencing normal aging. Yet their feet had been warning them for years. Today I'm going to show you 9 foot signs that could indicate diabetes is already affecting your body. Some of these signs are surprisingly common. Some are often mistaken for aging. And one of them is so frequently ignored that countless seniors delay getting help until serious complications have already developed. Stay with me until the end because sign number 9 is one that many doctors specifically look for during examinations, yet most people have never even heard of it. Before we start, tell me in the comments where you're watching from today. And if you've ever noticed unusual changes in your feet, type yes in the comments below. I read as many comments as possible and I love hearing from this incredible community. Let's begin with sign number 1. Tingling or pins and needles that seem to appear for no obvious reason. Have you ever been lying in bed, sitting comfortably in a chair, or simply relaxing when suddenly your feet started tingling? Most people assume they sat the wrong way. They blame age. They shrug it off and move on. But recurring tingling in both feet can be one of the earliest warning signs that elevated blood sugar is beginning to affect your nerves. Think of your nerves like electrical wires. Each wire is wrapped in a protective coating called myelin. When blood sugar remains elevated over time, that protective coating can become damaged. Signals that should travel smoothly begin misfiring. Messages become distorted. And what you feel is tingling, buzzing, or pins and needles. This condition is called peripheral neuropathy and it affects millions of people with diabetes. The frightening part is that it often begins years before a diagnosis. One of the best things you can do today is start moving. Even a simple 20-minute walk each morning can improve circulation and support nerve health. Sign number 2 is a burning sensation in your feet, especially at night. This is one of the symptoms patients describe most vividly. They tell me it feels like their feet are on fire. Yet when they touch them, the skin feels completely normal. What's happening? Damaged nerves begin sending false signals to the brain. Your brain receives a message that heat is present even when nothing is actually wrong. During the day, the sensation may be masked by activity and distractions. But at night, when everything becomes quiet, the burning suddenly becomes impossible to ignore. One patient told me it felt as if he was standing barefoot on hot pavement every single night. He assumed it was aging. It wasn't. A routine blood test later revealed type 2 diabetes. Sign number 3 may be one of the most important warnings on today's list. Small cuts, wounds, or blisters that heal very slowly. Let me tell you about a patient named Robert. Robert was 68 years old. One summer he developed a small blister after wearing a new pair of shoes. He didn't think much of it. Weeks passed. The blister remained. Then it became infected. When he finally came to the clinic, we discovered that his blood sugar had been elevated for years. High blood sugar damages the tiny blood vessels that deliver oxygen and nutrients throughout the body. Without proper circulation, wounds heal much more slowly. What begins as a tiny blister can become a serious infection. Tonight, Take 3 minutes and carefully inspect both feet. Look between your toes. Examine your heels. Pay attention to any cuts, cracks, redness, or sores. Your future self will thank you for it. Sign number 4 is discoloration around the ankles or lower legs. This sign often develops so gradually that people never notice it. You may see darker skin, a reddish tone, a bluish tint, or patches that simply look different from surrounding areas. These changes can occur when circulation becomes compromised. Healthy skin depends on healthy blood flow. When blood vessels become damaged, the skin often reveals the problem long before other symptoms become obvious. Here's something most people don't realize. Some studies suggest skin changes in the lower legs can appear many months before diabetes is formally diagnosed. That's a huge opportunity to catch a problem early. Before I reveal sign number 5, I need to tell you something important. The next sign is often dismissed as nothing more than dry skin, but it may actually be your nervous system asking for help. And if you're already experiencing signs 1 through 4, what comes next may surprise you. Sign number 5 is persistent cracked heels that never seem to improve. Many seniors spend years buying expensive creams and lotions hoping the problem will disappear. Sometimes it improves temporarily, but it keeps coming back. The reason may surprise you. Diabetes can damage autonomic nerves, which help regulate sweat and moisture production in your feet. As these nerves become damaged, the skin loses moisture from the inside out. The result is dryness, thickened skin, and deep cracks that seem impossible to eliminate. Moisturizing is important, but if severe cracking continues despite consistent care, it's worth discussing with your doctor. Now let me ask you something. Have you recognized yourself in any of these signs so far? If you have, type yes in the comments right now. And if you're finding this information valuable, click the like button. That simple action helps YouTube show this video to more adults over 60 who may desperately need to see it. Sign number 6 is swelling in the feet and ankles that leaves marks from your socks. At first glance, this may seem harmless. Many people blame heat, standing too long, or simply getting older. But persistent swelling can sometimes indicate that elevated blood sugar is affecting kidney function. Your kidneys play a critical role in regulating fluid balance throughout the body. When they become stressed, excess fluid often accumulates in the feet and ankles. If you regularly notice deep sock marks, puffiness, or swelling that seems to be getting worse, don't ignore it. Elevating your feet and reducing excess sodium may help, but it's important to discuss persistent swelling with your healthcare provider. Sign number 7 is sudden stabbing pain, electric shock sensations, or sharp shooting pain in the feet or legs. This is one of the most misunderstood symptoms of diabetic nerve damage. Many people assume it's arthritis. Others blame old injuries. But diabetic nerve pain often has a unique quality. It arrives suddenly. It feels like an electric shock. A hot needle. A stabbing sensation that appears out of nowhere. One woman described it as being zapped by electricity multiple times throughout the night. The pain was real. But the source wasn't her joints. It was damaged nerves sending incorrect signals to her brain. Gentle stretching, regular walking, and maintaining healthy blood sugar levels can help reduce the progression of this type of nerve damage. Sign number 8 is feet that constantly feel cold. Not just during winter. Not after spending time outside. Cold all the time. Cold even under blankets. Cold even when the rest of your body feels perfectly comfortable. This can be a sign that circulation is becoming impaired. Blood vessels damaged by years of elevated blood sugar may struggle to deliver enough warm blood to the feet. Think of it like trying to heat a distant room through narrow pipes. The warmth simply can't get where it needs to go. The good news is that regular walking remains one of the most effective ways to support healthy circulation. Even 10 minutes a day is a great place to start. And now we come to sign number 9, the warning sign that many people have never heard of. Hair loss on the lower legs and tops of the feet. This sign is incredibly easy to overlook because most people aren't paying attention to the hair on their legs. Yet it can reveal an important clue about circulation. Hair follicles require oxygen and nutrients delivered by healthy blood vessels. When circulation becomes compromised, hair growth gradually slows. The hair becomes thinner. Then it disappears altogether. Many healthcare professionals specifically look for this sign because it can indicate long-standing blood vessel damage. After this video ends, take a look at your lower legs and the tops of your feet. Compare them with the rest of your legs. You may notice something you've never paid attention to before. Now here's the most important message I want to leave you with. Finding one of these signs does not automatically mean you have diabetes. Finding 2 or 3 doesn't guarantee it either. But these signs are your body's way of asking for attention. They are warning lights on the dashboard. And warning lights should never be ignored. If you noticed multiple signs today, consider scheduling a simple blood test. Ask your doctor about a fasting blood glucose test and an HbA1c test. Those 2 tests can provide valuable information about your blood sugar and overall health. The earlier diabetes is detected, the better your chances of protecting your eyesight, your kidneys, your heart, your balance, and your independence. Because diabetes isn't just about blood sugar. It's about preserving your ability to live life on your terms. To drive your own car. To travel. To enjoy time with your grandchildren. To stay active, capable, and independent for as long as possible. Before you leave, think of one person in your life who needs to see this. A friend. A spouse. A brother. A sister. Someone who may be ignoring changes in their feet because they simply don't know what those changes could mean. Share this video with them today. It could make a bigger difference than you realize. And if you haven't subscribed yet, please subscribe and turn on notifications. Every week, I share research-backed health information designed specifically to help adults over 60 stay healthier, stronger, and more independent. Finally, tell me in the comments which of these 9 signs surprised you the most. I read every comment and I genuinely enjoy hearing your stories. Thank you for spending these minutes with me. Take care of your feet, take care of your health, and I'll see you in the next video.